If you're taking metformin for type 2 diabetes, there's something your doctor may have forgotten to mention. This medication, trusted by millions of older adults, could be quietly draining one of the most critical nutrients your body needs to function. And here's what makes this truly concerning. The symptoms of this deficiency look almost identical to normal aging. Fatigue, memory problems, balance issues, tingling in your hands and feet. Most people blame their age. But for nearly 3 out of 4 long-term metformin users, something else is happening beneath the surface. Your vitamin B12 levels may be silently dropping to dangerous levels, and the longer it continues, the harder it becomes to reverse. Today we're going to talk about why this happens, how to recognize the warning signs your body might already be sending you, and most importantly, what you can do about it before permanent damage occurs. Let's start with something important. Metformin is not a bad medication. In fact, it's one of the most widely prescribed and well-studied drugs for managing type 2 diabetes. It's been used safely for decades. It helps lower blood sugar, reduces the risk of heart complications, and for many people, it's an essential part of staying healthy. If your doctor prescribed it, there was a good reason. But like most medications, metformin comes with trade-offs. And one of the most significant trade-offs is something that often gets overlooked during routine doctor visits: the way it interferes with your body's ability to absorb vitamin B12. Now, you might be thinking, I take a multivitamin. Doesn't that cover B12? Not necessarily. And here's why this matters more than most people realize. Vitamin B12 is responsible for some of the most fundamental processes in your body. It helps build red blood cells, which carry oxygen to every tissue and organ. It protects the coating around your nerves, which is essential for sensation, coordination, and communication between your brain and the rest of your body. It supports DNA production. It plays a major role in energy metabolism, and it's crucial for cognitive function, mood regulation, and memory. Without enough B12, your body starts to break down in ways that are slow, subtle, and easy to dismiss. Here's the problem. Metformin interferes with B12 absorption in your intestines. The exact mechanism isn't fully understood, but research suggests that metformin affects how your body handles calcium, which is needed for B12 to be absorbed properly in the small intestine. It may also change the environment in your gut, reducing the availability of something called intrinsic factor, a protein your stomach produces that binds to B12 and helps shuttle it into your bloodstream. When you take metformin every day for months or years, this interference adds up. Your B12 levels begin to drop, and because your body stores B12 in the liver, the decline happens gradually. You don't notice it at first, but over time, those stores run low, and that's when symptoms begin to appear. Studies show that long-term metformin use, especially at higher doses, significantly increases the risk of B12 deficiency. Some research suggests that up to 73% of people who've been taking metformin for several years show measurably low B12 levels. That's nearly 3/4 of long-term users, yet many of them have no idea. Why? Because routine blood work doesn't always include B12 testing. And even when it does, the standard reference ranges may not catch deficiencies early enough to prevent symptoms. So, what does a B12 deficiency actually feel like? This is where things get tricky, especially if you're over 60. The symptoms are vague, they overlap with a lot of other conditions, and they develop so slowly that it's easy to attribute them to getting older. Let's walk through some of the most common ones. Fatigue is usually the first sign, not the kind of tiredness you feel after a busy day, but a deep, unshakable exhaustion that rest doesn't fix. You might feel like you're moving through fog. Simple tasks take more effort. You need more time to recover. Many people chalk this up to aging or stress, but if your B12 is low, your body isn't making enough healthy red blood cells. That means less oxygen reaching your muscles and brain. The result? Persistent, unexplained tiredness. Then there's the nerve-related symptoms: tingling or numbness in your hands and feet. A pins and needles sensation that comes and goes, or sometimes stays. Weakness in your legs, trouble with balance or coordination. These symptoms happen because B12 is essential for maintaining the myelin sheath, the protective coating around your nerves. When B12 levels drop, that coating starts to deteriorate. Nerve signals don't travel as efficiently. You lose sensation. You feel unsteady. For people with diabetes, this is especially confusing because diabetic neuropathy causes similar symptoms. So, the tingling gets blamed on high blood sugar, when it might actually be, or partly be, a B12 problem. And here's the critical part. If B12 deficiency continues long enough, nerve damage can become permanent. Cognitive changes are another red flag. Trouble concentrating, memory lapses, difficulty finding words, confusion or disorientation. Mood changes like depression, irritability, or anxiety. Again, these are symptoms people often dismiss as normal aging, or even early dementia. But B12 plays a vital role in brain function. Low levels can actually cause cognitive impairment that looks a lot like Alzheimer's disease. The good news is that if it's caught early and B12 levels are restored, many of these cognitive symptoms can improve. The bad news is that if it goes undiagnosed for too long, some of the damage may not be reversible. Other symptoms can include a sore or swollen tongue, pale or yellowish skin, shortness of breath, dizziness, or heart palpitations. Some people experience digestive issues or changes in their vision. The wide range of symptoms is part of what makes B12 deficiency so easy to miss. It doesn't present the same way in everyone, and because the symptoms develop over months or even years, they blend into the background of daily life. Now, let's talk about why people over 60 are especially vulnerable. Even without metformin, B12 absorption naturally declines with age. Your stomach produces less acid as you get older, and stomach acid is necessary to release B12 from the food you eat. You also produce less intrinsic factor, that protein we mentioned earlier. So right from the start, older adults are at higher risk for B12 deficiency. When you add metformin into the mix, the risk multiplies. You're dealing with two separate factors that both interfere with absorption. That's why age and metformin together create a perfect storm for deficiency. Another factor that doesn't get talked about enough is dosage and duration. The higher the dose of metformin and the longer you've been taking it, the greater the impact on your B12 levels. If you've been on metformin for 5 years, 10 years, or longer, your risk is significantly higher than someone who just started. And if you're taking 2,000 milligrams a day versus 500, the effect is more pronounced. This doesn't mean you should stop taking your medication. It means you need to be proactive about monitoring and protecting your B12 levels. Here's something that might surprise you. Even if you eat a diet rich in B12, it may not be enough to overcome the absorption problem caused by metformin. B12 is found in animal products, meat, fish, poultry, eggs, and dairy. If you're eating these foods regularly, you're getting B12 in your diet. But if your body can't absorb it properly because of metformin, it doesn't matter how much you consume. It's like pouring water into a bucket with a hole in the bottom. You can keep adding more, but you're still losing it faster than you can replace it. So, what should you do if you're taking metformin? The first step is awareness. If you've been on metformin for more than a year, especially if you're over 60, you should talk to your doctor about having your B12 levels tested. The standard test is a serum B12 blood test. It's simple, inexpensive, and widely available. Some experts also recommend testing for methylmalonic acid or homocysteine, which are more sensitive markers of B12 deficiency, especially in the early stages. If your doctor hasn't mentioned B12 testing, bring it up yourself. Many healthcare providers are aware of the connection between metformin and B12 deficiency, but it's not always top of mind during a routine visit, especially if you're not reporting specific symptoms. If your test results show that your B12 is low, or even in the low normal range, the next step is supplementation. B12 supplements are safe, affordable, and effective. They come in several forms: oral tablets, sublingual lozenges that dissolve under your tongue, nasal sprays, and injections. For most people taking metformin, oral or sublingual B12 in the form of methylcobalamin or cyanocobalamin works well. Doses typically range from 500 to 1,000 micrograms per day, though some people may need more depending on the severity of the deficiency. The sublingual form may be slightly more effective because it bypasses some of the absorption issues in the gut. In cases of severe deficiency or when symptoms are already present, doctors may recommend B12 injections, which deliver the vitamin directly into the bloodstream and bypass the digestive system entirely. It's also worth noting that B12 is water-soluble, which means your body excretes excess amounts through urine. This makes it very difficult to overdose on B12. Taking a supplement, even if your levels are normal, is generally considered safe. But of course, you should always discuss supplementation with your healthcare provider, especially if you're managing multiple medications or health conditions. Now, let's talk about prevention. If you're already taking metformin and your B12 levels are currently normal, you don't have to wait for a deficiency to develop. Proactive supplementation can help maintain healthy levels even while continuing the medication. Some doctors recommend that anyone on long-term metformin take a B12 supplement as a preventive measure. This is particularly important if you have other risk factors, such as age over 60, a history of stomach issues, low stomach acid, or a diet low in animal products. If you follow a vegetarian or vegan diet, your risk is even higher. Plant-based foods don't naturally contain B12 unless they're fortified. So, if you're managing diabetes with metformin and you're also avoiding animal products, supplementation isn't optional, it's essential. Another practical step is to monitor your symptoms. Pay attention to changes in your energy, mood, memory, or sensation. Keep a journal if it helps. If you notice new or worsening symptoms, especially the ones we discussed earlier, don't wait for your next annual checkup. Schedule an appointment and request a B12 test. Early detection makes all the difference. When B12 deficiency is caught early, it's completely reversible. When it's ignored for years, the damage to your nerves and brain can become permanent. It's also important to have an ongoing conversation with your doctor about your metformin therapy. For some people, the dose can be adjusted. For others, there may be alternative medications that manage blood sugar effectively without the same impact on B12. This isn't a decision you should make on your own, but it's a conversation worth having, especially if you're experiencing symptoms or if managing your B12 levels becomes difficult. Let's address a common concern. Some people worry that if they bring up side effects or complications from their medication, their doctor will think they're being difficult or non-compliant. But advocating for your own health is not only appropriate, it's necessary. You know your body better than anyone else. If something doesn't feel right, it deserves attention. A good healthcare provider will welcome your questions and work with you to find solutions. If you feel dismissed or unheard, it may be worth seeking a second opinion. Here's another angle that's often overlooked. Pharmacists can be an excellent resource. They're highly trained in medication interactions and side effects, and they're often more accessible than doctors. If you have questions about metformin and B12, or if you're unsure about which supplement to choose, talk to your pharmacist. They can provide guidance, recommend specific products, and even alert your doctor if they notice a potential issue. Now, let's zoom out for a moment and talk about the bigger picture. The connection between metformin and B12 deficiency is a perfect example of why medication management needs to be holistic, especially as we age. It's not enough to just treat the primary condition. We have to consider the side effects, the nutrient depletions, the interactions, and the cumulative impact of long-term use. This is true for metformin, but it's also true for many other commonly prescribed medications. Proton pump inhibitors, which reduce stomach acid, can also interfere with B12 absorption. So, can certain antibiotics and medications for heartburn. If you're taking multiple medications, the risk compounds. This isn't meant to scare you or make you distrust your treatment plan. It's meant to empower you to take a more active role in your health. Ask questions. Request tests. Stay informed. And don't assume that just because a medication is commonly prescribed, all the risks are being actively managed. Sometimes things slip through the cracks, not because of negligence, but because healthcare is complex and time during appointments is limited. One more point that's worth emphasizing. The symptoms of B12 deficiency can have a serious impact on quality of life. Chronic fatigue affects your ability to stay active, to socialize, to enjoy hobbies. Nerve damage can make walking difficult and increase the risk of falls. Cognitive decline can lead to isolation, fear, and loss of independence. Mood changes can strain relationships and lead to depression. These aren't minor inconveniences. They're life-altering. And the frustrating part is that many people suffer with these symptoms for years without realizing there's a fixable cause. A simple blood test and an inexpensive supplement could make a profound difference. Let's also touch on the emotional side of this. If you've been feeling off for a while, tired, forgetful, unsteady, and you've been told it's just part of getting older, it can be incredibly validating to discover there's an actual treatable reason. It's not all in your head, you're not imagining it, and you're not failing at aging. Your body is responding to a nutritional deficiency that has a clear cause and a clear solution. That knowledge alone can be empowering. So, to bring this all together, if you're taking metformin, especially if you've been on it for more than a year and you're over 60, here's what you need to do. First, request a B12 test at your next doctor's appointment, or schedule one specifically for this purpose. Second, pay attention to your symptoms: fatigue, tingling, memory issues, balance problems. These are all potential red flags. Third, consider starting a B12 supplement, ideally after discussing it with your doctor, but know that it's generally safe and may offer significant benefits. Fourth, make sure your diet includes B12-rich foods if possible: eggs, fish, chicken, dairy, fortified cereals. And fifth, stay proactive. Don't wait for a crisis. Regular monitoring and early intervention are your best tools. If you're watching this and you've already been diagnosed with a B12 deficiency, know that you're not alone. It's one of the most common nutritional deficiencies, especially among older adults, and it's highly treatable. With consistent supplementation and monitoring, most people see significant improvement in their symptoms within weeks to months. Your energy returns, the tingling fades, your mind feels clearer. It's not an overnight fix, but it's a real one. And if you're watching this on behalf of a loved one who takes metformin, a parent, a spouse, a friend, consider sharing this information with them. Many older adults aren't aware of this connection. They might be suffering in silence, attributing their symptoms to age or other conditions, without realizing there's something simple they can do. Sometimes the most caring thing we can do is gently raise awareness and encourage someone to ask their doctor a few important questions. Metformin has helped millions of people manage their diabetes and live longer, healthier lives. But like any medication, it's not without risks. The key is to use it wisely, monitor for side effects, and take steps to protect the nutrients your body needs. B12 deficiency doesn't have to be an inevitable consequence of taking metformin. With awareness, testing, and supplementation, you can enjoy the benefits of the medication without sacrificing your energy, your nerves, or your mind. Before we wrap up, let's recap the most important points. Metformin can interfere with your body's ability to absorb vitamin B12. Long-term use, especially at higher doses and in people over 60, significantly increases the risk of deficiency. The symptoms: fatigue, tingling, memory problems, balance issues, are often mistaken for normal aging. B12 deficiency is silent, gradual, and potentially serious, but it's also preventable and treatable. Testing is simple, supplementation is safe and effective, and early intervention can prevent permanent damage. If you're on metformin, don't wait. Talk to your doctor, get tested, take action. Your future self will thank you. We'd love to hear from you. Has anyone watching this ever had their B12 levels checked while taking metformin? Did you notice any symptoms that improved after starting a supplement? Or maybe you're just learning about this connection for the first time. Drop a comment below and let us know where you're watching from and what stood out to you most in today's video. And if you found this information helpful, consider sharing it with someone who might benefit. Knowledge is one of the most powerful tools we have when it comes to aging well. Thanks for watching, and we'll see you in the next one.